Ever wondered why some men struggle to father a child despite countless attempts? Today we're unmasking a topic that's more common than you might think: male infertility. It's a journey that many men embark on, often filled with questions and uncertainty. Recognizing the causes can be the first step towards finding solutions. From sperm disorders to hormonal imbalances and even genetic factors, the world of male infertility is intricate and complex. Let's delve into the world of male infertility and uncover the facts. Male infertility refers to a man's inability to cause pregnancy in a fertile female partner, despite regular unprotected sexual intercourse. This can be an emotionally challenging issue, but it's more common than you might think. Infertility is not exclusive to women. Men can also face these challenges. In fact, in a significant number of cases, the cause of a couple's infertility is due to male factors. The causes of male infertility are varied and numerous, ranging from physical issues like sperm disorders or testicular factors, to hormonal or genetic disorders. There can be issues with sperm count, sperm motility, or even the shape of the sperm. Hormonal imbalances or genetic conditions can also play a role. It's important to remember that these issues are not a reflection of one's masculinity or worth. Now that we've defined male infertility, let's explore the various causes. Sperm disorders are a major cause of male infertility. Let's delve into the details of these conditions and their impacts on fertility. Low sperm count, also known as Oligospermia, is when the number of sperm in a semen sample falls below the normal range. This can make it more difficult for a sperm to reach and fertilize an egg, leading to potential fertility issues. On the more extreme end of the spectrum is Azoospermia, which is when there are no sperm present in the ejaculate. This condition can be due to a blockage that prevents the release of sperm or a problem with sperm production itself. It's like showing up to a race without a car. Without sperm, fertilization of the egg is impossible. Moving on, we have sperm motility disorders. Asthenospermia is a condition characterized by reduced sperm motility. Think of motility as the ability of the sperm to swim. If a sperm is a poor swimmer, reaching and fertilizing the egg becomes a challenging task. Another important aspect of sperm health is morphology, or shape. Teratospermia is a condition where the sperm have unusual shapes. Picture this: trying to fit a square peg into a round hole. Sperm with abnormal shapes may face difficulty penetrating the egg, which is crucial for fertilization. Now you might be thinking, well, as long as there are a few good sperm, it should be fine, right? While it's true that it only takes one sperm to fertilize an egg, these disorders can significantly decrease the chances of successful fertilization. Also, it's worth noting that a man could have a combination of these disorders, further complicating the situation. However, it's not all doom and gloom. Various treatment options are available, from lifestyle changes to medication and even surgical procedures, depending on the specific disorder and its severity. Sperm disorders can be a hurdle to fatherhood, but they aren't the only cause of male infertility. Stay tuned as we explore other factors contributing to male infertility in our upcoming sections. Ejaculation and hormonal disorders can also play a significant role in male infertility. Let's delve into ejaculation disorders first. One such disorder is premature ejaculation, where ejaculation occurs either before or just after penetration. This reduces the time the sperm has to travel to the egg, thus reducing the chances of successful fertilization. On the flip side, we have delayed ejaculation. Men with this condition find it difficult to reach the point of ejaculation. This can be just as problematic, as it can lead to missed opportunities for fertilization. Now let's transition to hormonal disorders. Hormones are crucial in the production and functioning of sperm. Hypogonadism, for instance, is a condition where the testes produce insufficient amounts of testosterone. Testosterone plays a crucial role in the production of sperm, and a deficiency can therefore lead to a decrease in sperm count. Another hormonal disorder is hyperprolactinemia, which is characterized by elevated levels of prolactin. Prolactin is usually beneficial, but too much of it can interfere with other hormones that stimulate the testicles to produce sperm. In turn, this can lead to a decrease in sperm count, or even to Azoospermia, which is the complete absence of sperm in the ejaculate. Both ejaculation and hormonal disorders can have significant impacts on male fertility. However, it's also important to note that these disorders are treatable. Treatments can range from behavioral techniques and medications to hormone replacement therapy, all aimed at restoring normal ejaculation or hormonal balance. While these issues can be challenging, they are only part of the complex puzzle of male infertility. To fully understand the scope of this issue, We must also consider other factors such as testicular and genetic disorders, varicocele, infections, and immunological factors, all of which we'll explore in the upcoming scenes. Stay tuned to gain a comprehensive understanding of this multifaceted issue. Scene script. Testicular factors and genetic disorders can significantly impact a man's fertility. Diving into testicular factors first, let's talk about cryptorchidism, a condition in which one or both of the testes fail to descend. You see, during fetal development, the testes usually descend into the scrotum. If they do not, sperm production can be affected due to the higher internal body temperature. This condition, if not corrected early in life, can lead to lower sperm counts or even Azoospermia, where no sperm is present in the semen. Next, we have testicular injury or trauma. It's pretty straightforward. Damage to the testicles can impact their function, including sperm production. Injuries might occur due to accidents, sports injuries, or surgical procedures, and depending on the severity, they can lead to temporary or permanent fertility issues. Now let's shift gears a bit and delve into genetic disorders that can contribute to male infertility. First up is Klinefelter syndrome. This is a genetic condition where a male is born with an extra X chromosome, leading to a configuration of XXY instead of the typical XY. This additional chromosome affects testicular development and function, often resulting in lower testosterone levels and sperm production. Last but certainly not least, we have mutations in the cystic fibrosis transmembrane conductance regulator or CFTR gene. These mutations can lead to a condition known as congenital bilateral absence of the vas deferens or CBAVD. In this condition, the tubes that carry sperm from the testes to the urethra are absent, effectively blocking the path of the sperm and thus impacting fertility. These factors highlight the intricate nature of male fertility, but there are still other causes to consider. It's crucial to remember that these conditions do not necessarily mean that achieving pregnancy is impossible. Modern medicine offers a variety of treatment options and strategies to overcome these challenges. So if you or someone you know is grappling with infertility, don't lose hope. Consult with a healthcare professional or a fertility specialist for a comprehensive evaluation and guidance. Varicocele, infections, and immunological factors can also contribute to male infertility. Let's start with varicocele. This condition is characterized by an enlargement of the veins within the scrotum, quite similar to varicose veins that some people might have in their legs. This swelling can cause a decrease in sperm quality and production, and it may even lead to testicular shrinkage. The exact reason why varicocele affects fertility is still not fully understood, but it's thought that the increased temperature from the swollen veins may have an impact on sperm production and function. Moving on to infections, these can interfere with sperm health or production, or they can cause scarring that blocks the passage of sperm. The types of infections that are often linked to male infertility include sexually transmitted infections such as chlamydia or gonorrhea, prostatitis, which is an inflammation of the prostate, and epididymitis, an inflammation of the tube that carries sperm. It's important to note that even after these infections have been treated, they may still affect fertility. Last but not least, let's discuss immunological factors. In some cases, a man's immune system can produce anti-sperm antibodies. These are immune system cells that mistakenly identify sperm as harmful invaders and attempt to eliminate them. This can happen after an infection, injury, or surgery of the reproductive tract, and can lead to a decreased sperm count or sperm that clump together, both of which can affect fertility. So, as you can see, varicocele, infections, and immunological factors can have a significant impact on male fertility. Each of these causes has different mechanisms of action, but they all ultimately lead to a decrease in the number, quality, or function of sperm, which can make it difficult for a couple to conceive. Understanding these causes can help in the management and treatment of male infertility. Male infertility is a complex issue with diverse causes, from sperm disorders, ejaculation and hormonal disorders, to testicular and genetic factors, varicocele, infections, and even immunological factors. It's clear that a combination of these can contribute to infertility in men. A thorough medical evaluation is vital to pinpoint the specific causes in each individual case. Remember, understanding is the first step towards finding a solution. Consult a healthcare professional if you have concerns about fertility.